We had people, we had illnesses, we had people dying, people suffering from illnesses. We had great things, great physicians. And like, for example, the Indian system of medicine, we had Sushruta, in whose name you all took Sushruta was a surgeon and was considered the first surgeon, and Charak, who was the first physician. You all took the Charak code recently, about 3 weeks back, if I'm not mistaken. And similarly, along with the Indian system, Indian civilization, we had also people in Greece. They had, of course, they had Hippocrates, who started the Hippocratic Oath, which you all are following after after passing out exams. Then we had the Arab system of medicine. The Arab system also had its own thing. And then much later, the British system came and they tried to evolve something. And with that, we Indians, back in India also, we started following the British system. And with that, the first medical school was opened in Calcutta, 1835, Calcutta Medical College. I'm part of that institution. And then we moved on. Now the question here is, we always think of the MBBS doctor as being superior to the others. I mean, that's natural if you come through a very tough exam and all that. But there are so many people who go to the other alternative practitioners also, which is why the government has brought this Ayush, Ayurveda, Unani, and other stuff, homeopathy, etc. So while we should appreciate our skills, I would personally say it's not good to deride or degrade others' things. If Ayurveda is good, if serious Ayurveda is practiced, it has got no side effects, unlike our system which has side effects. Unani, homeopathy, I'm not very sure, I can't comment. Homeopathy, a lot of people say that it's good and bad. Anyway, so coming back to the basic thing, community medicine and why it started. So we've had a lot of illnesses which came basically as a result of various factors, which is not related directly to the individual, but to society at large. So, can you name any illness which has been any common illness which is caused by society? Anybody? Can you name any common illness which is caused by society? What did you say? Any common illness? Okay, influenza. Very good. Influenza is not caused by society. Okay, it can sway by the environment. Yes, fine. So you cannot control the environment completely, but there are certain illnesses where you can control the environment. For example, cholera. Cholera is one disease which actually started from the contamination of a tube well, and that tube well led to the discovery that if the tube well in London, mind you, that led to the discovery that the cholera infection can be spread like that. That is one of the first scientific discoveries, and that actually was the foundation of public health. Okay, so Dr. John Snow, who was an anesthetist by profession, he was the person who found out this cholera, though the cholera bacilli was found out much later. So that is the first thing. Now, second thing is, you have other diseases also which are related to social problems, like for example, tuberculosis. TB is one disease where you need people are sick. People are sick and people fall sick very fast. One of the main problems with tuberculosis is that there is lack of nutrition. Okay, so it's a vicious cycle. Lack of nutrition, patient becomes infected with tuberculosis, and then there's again a social aspect. He spreads it to his family members, he coughs out, and also earlier days the family would ostracize him. That means they would isolate him. Isolate him means socially, not physically. So these are the things which developed community medicine as a subject actually. Later on what happened was, then we had the Great Plague. Okay. So we had, I think I've got the slide over here, I'll show you, check out that. It will show the Great Plague in London. So that, all that created the part of medicine which is called community medicine. So In India, again, once you finish your MD, if you're doing an MD in community medicine, you get out of the course, people ask you, sir, what doctor are you? What sort of doctor are you? You say community medicine. What medicine? They're not aware of community medicine. Till 10 years back, that was the case for most people. Fortunately, we've had a few things. Like 10 years back, little more. I was working in polio program for 8 years in WHO. After that, I came back and I joined a medical college in Kerala. And then I started practicing also. People used to say, what are you practicing? So I used to say, I'm doing community medicine. They never understood what community medicine was. So then the next question was, I used to say it's something to do with vaccination or vaccinations. Okay. So vaccination part only. Then we had Nipah, Nipah. Have you heard of Nipah? Yes or no? Yes. Nipah attacked Kerala and then it became big news. It became internationally well known. And then I said, again, we are also involved in Nipah. People used to ask me, are you treating Nipah? I said, it's not easy to treat Nipah, but we know how it spreads. Then finally, the corona pandemic came when everybody had to refer to us for updates and things like that. So my point, what I'm trying to say is community medicine is a good subject. It takes a lot of things. It takes care of the society as well as the individual, not just the individual. And again, community medicine is now you have as part of the government's initiative, you have a family adoption program. Have you gone for the family adoption program? No, you'll be going for the family adoption program. So each of you will have to adopt, I think, 5 families and follow them throughout the MBBS. So you learn the health problems of the family, the health problems of the individual, their living styles, their problems. Like for example, the environment, the society in which they stay, whether they have any other problems like addictions, alcoholisms, things like that. So that is about the basic concept of community medicine. So when I was in first year, we had a class by a very senior teacher. I think she's no more, professor. She taught us community medicine, but that was just like we were sitting in the class, but we were all bored. She started off with talking about septic tanks. Okay, so we were naturally when you come to studying medicine, what is the interest of septic tanks to the first year? We were really bored with that subject. But today we find that for everything, how a disease spreads, you need community medicine. You need to know the risk factors. How can you prevent it? Like 3 years back, most of us were wearing masks, right? When you were studying in school or where you used to be wearing masks because of the corona period, washing your hands. These were all part of the epidemic control measures. So I'll just go through the slides fast. So when we talk about health, we talk about physical, mental and social well-being. Okay. So as per the definition of WHO, you don't have to note, this is the detailed class will be dealt with much later. Physical, social, mental and spiritual well-being. Now, physical is something, spiritual is something, mental is something else. So many people who we look as physically fit, they may be having some other problems which we are not aware of. So that is one major issue which is there. So whenever you say the WHO definition of health is a state of physical, social and mental well-being. Okay. So now this was the absence of disease was the old definition. Now they say it's the presence of physical, mental and social well-being. So you had a biomedical concept, ecological concept, psychosocial and holistic concept. So if everybody here is free of disease, you are healthy, but you're not healthy. If somebody's got a mental problem, somebody's got some other problem, he's considered unhealthy. But this was the biomedical concept. If a person is free from disease, he's considered healthy. Okay, just free from disease. He may be having something else, but if he's free from disease, then he's considered healthy. This was the old biomedical concept. So this was the ecological concept, absence of pain, discomfort and a continuous adaptation to the society to ensure optimum function. This is this was again man and environment. That was the concept. So health also depends on the environment. That was the second concept, which was the ecological concept. Then they said that health is not just a medical thing, it also involves the psychological. So social, psychological, cultural, economic, political and factors of people concerned. So obviously the health factors, you have the people of, say for example, Shantiniketan will be different from those in, say, in a war zone like Gaza or some other place. So you have the psychological problems, you have cultural problems and so on. So synthesis of all this gives you the present approach that all sectors of society have an effect on health, particularly animal food, education, industry, housing, public society, other sectors. All of them have an impact on health. It's not just absence of disease. Okay. So this was the definition of health which I talked about earlier, absence of disease. It's no longer the absence of disease, it's a different health. Again, it's a level of functional or metabolic efficiency of a living being. So nowadays what is health? Somebody can do 50 push-ups, he's considered very healthy. Somebody can do 25 push-ups, he's considered less healthy. Somebody's got a six-pack abs, he's very healthy. That's not that. There are a lot of other things also. So it's a general condition of person, mind, body and spirit, usually meaning to be free from illness, injury or pain. Okay. So this is the definition of WHO definition. This definition should learn by heart. No changes in the definition and the order, physical, mental and social well-being, and not merely the absence of disease or infirmity. During the orals, your seniors, they fumbled a bit. They said social well-being first, they said physical well-being last. It is physical, mental and social well-being and not merely the absence of disease or infirmity. I've personally seen some of your students lose marks because of the change of the words. They said the same thing, but they lost 5 marks, 7 marks because they interchange the words. Physical comes first, mental comes first, then social well-being. So you can remember it PMS well-being and not merely absence of disease or infirmity. This was a definition of WHO in 1946. Then this again, dimensions of health. This is again a question which is asked in the MBBS questions. Physical, mental and social well-being and other dimensions which can be included are spiritual, emotional, vocational and political. Okay. So these are the classical dimensions are physical, mental and social well-being. So physical health again means same thing, proper functioning of the body, energetic, has good posture, weighs normal for age and height, has all body functions normally, no issues, good textured shining hair, gets sound sleep, has a good appetite, has a clean breath. And the person is physically healthy if he or she looks alert and responsive. So this is the, when you say a person is healthy, he should have this criteria. The person should look healthy, good posture, weighs normal for age and height, all body functionings normally, bright eyes, good texture, shining hair, good sleep, good appetite, clean breath. And is physically healthy if he or she looks active and alert and responsive. Okay. Mental health is another important aspect. Control. You should have the control in emotion. Now we talk a lot about emotional these days. Emotional intelligence is another word which is coming. Emotion, how emotive you can be. So sensitive to the need of others, confidence in one's own abilities, and a person is mentally relaxed if he or she is relaxed and free from any worries. Okay. Now mentally ill again, some of us may not be that mentally ill for various reasons. We have some worries, some exams, attention, something else. So mental health is another major factor. Next, for it. Spiritual again, if he possesses sound mind in a sound body. Okay. It's not that he has to become a big sannyasi or somebody like that, but sound mind in a sound body. Okay. So this again combines physiology and psychology to some extent. Sound mind is the psychology part, sound body is the physical part. So it's something that transcends physiology and psychology. Next. If he does not, he is considered emotionally healthy if he does not lose his temper or does not develop tension and should have self-control. So these are things which we normally, though it's easy to say this, very often many people are there who lose their temper for small reasons. For very small reasons they lose their temper. So this is, if he should be emotionally healthy, he should be happy, he should not lose his temper and should have control over his emotions for it. Vocational means he should be capable of earning his livelihood successfully, living his life successfully. Positive health. A person who is healthy physically, spiritually and mentally is said to be in a state of positive health. That is highest standard of health. Okay. So if he is in all this, he is considered. If as you age passes, we sometimes land up with medical ailments like diabetes is one, high cholesterol is another, dyslipidemia, joint pain, all this. But those are obviously not considered as positive health for it. So, concepts of well-being, again, standard of living, there are objective and subjective. Objective is what you do, and subjective is what others feel. Okay. The standard of living is objective and levels of living, and subjective is what others feel. Now, if you standard of living, somebody like say a film star in Mumbai, he is living in a very big style in a 7-story apartment. 7-story building of his in Bandra. That is the standard of living? His level of living is also that. Quality of life, what does his quality of life? Does he get time to spend free time in the park? What are the other things? Does he get privacy? A lot of things are there. So that is what is subjective, that is quality of life for it. So standard of living is scale of expenditure, goods we consume, services we enjoy, levels of education, employment, status, food, dress, house, amusements and comforts of modern living. So this is what we mean by standard of living. Now today, or maybe for 10 years back, a smartphone was you can say luxury. Today everybody's got a smartphone. Today everybody is doing digital payments, almost everybody. So previously we had to carry money with us. We would sometimes get pickpocketed and all that. Now things have changed. Standard of living, these are the minimum things which we require for it. So income, these are all things which can assess the standard of living: income, occupation, standard of housing, sanitation, nutrition, level of provision, health, education, recreational and other services. And these are all used as standard of living, okay, now by the WHO. So obviously that varies from place to place within the same country also. A poor farmer from say West Bengal may not have the same standard of living as somebody else who's another farmer who's a rich farmer in say Maharashtra or some other place. Okay, for it. So again, levels of living again depends on certain factors like health, food consumption, education, occupation, working condition, housing, social security, clothing and human rights. So each of this is important for the level of living. Okay, just because you have health, you may be healthy but you're living in a very small place, unhygienic place, that can add to your problems. Then again, food consumption. How much food do you take? You take little food, or do you take a lot of food? Do you take a lot of junk food? Or you can live with just 2 meals a day, it's fine. Then education. How educated are you? You don't have to be in a medical college or a profession. You can just take a small bit and be educated. Then again, occupation, working conditions, housing, social security. By the word social security means the person is getting entitled to some sort of insurance or some benefits if he falls sick. So, like now we have various programs, Pradhan Mantri, Ayushman Bharat Yojana and all this stuff. So, all private insurance, clothing and then human rights. Next. So, according to WHO, the quality of life results from combination of all these factors for determining health, happiness, education, social and intellectual attainments, freedom of action, justice and freedom of expression. So, all these terms, you might get confused. Some may think it's very hi-fi terms, but basically it's a combination of all these things which you saw in the previous slide. That is the quality of life. Okay, the condition of life resulting from combination of the effects of the complete range of factors such as those determining health, happiness, education, social and intellectual achievements, freedom of action and justice and freedom of expression. Now, in many countries, people they say they're not happy. You go to Bhutan they say is the happiest country, everybody is smiling. Bhutan people, they're not very crazy about money or very flashy cars or a lot of things. They're happy. But you go to another country like say Singapore, they have lots of money, small place, roughly same size as Bhutan, but they're not happy because the government takes them for tax and they work under pressure, they work 14 hours a day, 16 hours a day, that sort of thing. So, So that's quality of life also involves all this. Okay, for it. Determinants. Now, determinants of health. Some are within the body and some are outside the body. The ones within the body are genetic factors, and the ones outside are environmental factors. For it. So again, genetics is something which is there, which we cannot change. Like if there's a strong family history of, say, coronary artery disease in your family, there is a chance that you can get coronary artery disease. If there is a history of cancer, some cancers are familial, like breast cancer is familial. So if somebody's grandmother or somebody's grandmother or somebody's like that has got breast cancer, there's a chance that the granddaughter or somebody could, there's a freak chance that that person could be having cancer. So genetics is something which you cannot change for it. Environment. Environment consists of various organs and systems of body. This is the internal environment. External is physical, biological, social. Okay. So physical is air, soil and water. That is the physical environment. Biological is plants and animals. Social is culture, beliefs and tradition. So anything which upsets that can change the health of individuals. Okay. Suppose, for example, there's a flash flood or there's a flood in Shantiniketan. Naturally, some of us will be suffering from some illnesses, waterborne disease, various other diarrhea, etc., etc. Okay. Then again, plants and animals, social, cultural beliefs and traditions, and any disturbance of this can cause, can disturb the health of individuals. Then lifestyle, socio-economic conditions, education, occupation, income, health services. So lifestyle, economic conditions, education, occupation, income, that's all within our control. Health services is what you get from the government and whether you can avail it. A very poor person, for example, he may not be able to go to the hospital because he doesn't have money, or the hospital may be very far from his place. He is staying on the top of a hill. Hospital. So whether he is able to go to the hospital and get the medical treatment, that is also part of health service for it. Other factors affecting health, we all know, personal hygiene is one, then exercise, rest and sleep, posture, clean home environment, influence of smoking, alcohol and drugs, climate and clothing, and safety measures at play and work, and eating habits. Okay. So these are all the things which affect health in a big way. We all know this part. The indicators of health, when you measure the health status of a country, how do you compare, say, health status of India is very good or USA is very good. So you have to compare it. So these are the guidelines which indicate the health status. To assess, that also gives us a chance to assess the healthcare needs and to plan and implement healthcare services and to evaluate the healthcare services. Say about 25 years back, we never had a very good vaccination program, but now under our government's initiative, we are having vaccination programs for every child so that we are able to get rid of many diseases for it. So these are the indicators of health. Mortality indicators, that means how many people are dying per year. Okay. Out of the population, how many people are dying per year? Morbidity indicators, how many people are going to the hospital, how many are spending days in the hospital. Disability rate, how many have got some disability, like somebody has crutches, somebody is without a foot, somebody is blind, etc. Nutritional status, that's again, you have to compare nutritional status. Nutritional status of Adivasis and Birbhum will be different from the nutritional status of some other people in, say, some other district of West Bengal, Sundarbans or something like that. Healthcare delivery indicators, whether they are getting the facilities of healthcare, whether they are getting antenatal care or not, whether the ASHA worker is going to the house or not. Then utilization rates, I mean indicators of social mental health. Utilization rates. Utilization rates means how often is the person going to the hospital, whether he is getting the benefits from the government. Indicators of health policy, indicators of quality of life, environmental indicators and other indicators. All these are part of the study. Okay. Next. So mortality indicators are crude death rate, infant mortality rate (IMR), and maternal mortality rate and crude mortality rate. Okay, so crude you will learn more in the details in your theory class. Crude death rate is number of deaths per 1,000 population in a given year. So if you find a number of deaths are high, that means something is wrong. There's an epidemic or something really, some other problem is there. Infant mortality rate is number of persons, death of infants. Infant is a person, is a child below the age of 1 year per 1,000 live births. So this is the important indicator of health because it reflects not only the quality of maternal child services, also the quality of health services. So maternal child health means the child should be delivered in an institution and then there should be a safety mechanism in which the child and the mother are healthy. And maternal mortality is about antenatal, natal and postnatal deaths. Okay, that is maternal mortality. Child mortality rate is in deaths below 4 years per 1,000 mid-year population, and this excludes infant mortality rate. So actually up to 4 years, but it excludes the infant mortality rate. So morbidity indicators, as I told you, how many people are suffering from diarrhea, how many people are suffering from chicken pox, how many people. So you have incidence rate, notification rate, outpatient attendance rate, hospital admission and discharge rate. So these are all morbid. So if you find that a lot of people are coming to the hospital, it means that either the hospital is good or people are suffering from disease more. Similarly, notification rate, how quickly do we pick up a case? Is it a good case or bad case? Suppose for example there is an epidemic of some new diseases come. So has the case been picked up by the district and notified? Then outpatient attendance rate, hospital admission discharge rate, duration of stay in the college, in the hospital. Incidence rate is new cases, prevalence rate is old and new cases. So prevalence rate is used for chronic disease, usually like tuberculosis. You have old and new cases. Then you have, that's actually percentage of the population suffering from a disease. Disability rate is percentage of population unable to perform their normal duties. Somebody is walking with a crutch or is in a wheelchair, he cannot perform his duty normally. Yes, maybe he may not be able to climb unless there's a ramp or some elevator or a lift or something. Then nutritional status indicators low birth weight, height and weight of children up to 5 years. Healthcare delivery indicators, that is what are services are given to the people in the country over the up to 5 years, and thus the provision of healthcare. So unless you give you give services, people won't come. Suppose you want to give health service to somebody sitting in, say, Ladakh or Arunachal Pradesh in a very difficult area. So unless there is service there and people come to take the service, it's of no use. Then utilization rate, I told you, percentage of people utilizing it. For example, one of the things in India is, or probably the world, is that up to 1 year, the child is, the parents are very watchful about the children. So child is born, ensure the child is fully immunized. So they take the child. So that one of the indicators is percentage of people who are fully immunized. Then indicators of social mental health includes crimes like assault, murders, theft, suicides. These are all indicators of mental health. Okay. Some countries have different things, like for example, in USA, for example, many of the crimes are related to blacks. I mean, I shouldn't be using the word blacks, but those are the people who generally are from the lower strata of society. They indulge in crimes, and many of the crimes are attributed to it. Okay, so that's all for now.